A deformation is a disfigurement of a body part in a person that makes it appear abnormal either in shape or size. Usually, the causes of deformity include gene mutation, a damaged uterus or fetus, birth problems, chronic paralysis, and other conditions. In today's video, we will take a look at a list of amazingly deformed individuals who have been lucky enough to live despite their conditions. Joseph Merrick, the Elephant Man. To start us off with a quick fact, did you know that the most horribly disfigured individual to ever live was nicknamed the Elephant Man due to his extreme deformation? Joseph Merrick's deformation made his appearance unique as he has never been seen before and made his skin look like an elephant's skin. Born in Leicester, Merrick's condition began to develop while he was still just a child. This disfigurement led to rejection even by his own family and forced him to be displayed as an exhibition in London. To this day, the cause of his deformity is not known. Alimjan Nematilev. At the age of 7 years, this little boy from Kazakhstan had his twin growing inside of his body, a condition known as fetus in feta. While attending school, Alimjan developed stomach complications and was referred to a local hospital. The doctors who examined him then concluded that the lump in his abdomen was just a cyst. However, in the following week, the doctors were astonished after operating on the boy, only to find a fully developed baby growing in the boy. The baby was actually a length of 20 centimeters and weighing 2 kilograms. Although Alimjan survived from the operation, it is not really known what caused the condition in the little boy. Jose Mester. Meet the second individual on our list, Jose Mester from Portugal, who from the age of 14 years began developing a tumor on his face, which grew to be an astonishing 12-pound mass. Blood vessels gradually grew in size on the man's face, to a point of obstructing his vision and limiting his ability to eat and breathe. By the age of 53 years, Jose Mester, who had been serving as a lifeguard, had lost all hope of ever receiving any treatment for his condition after a futile search for help from hospitals in Portugal. This was as a result of medical misdiagnosis, religious beliefs, and the lack of funds. Luckily for Mr. Mester, a stranger only known by the name of Peter introduced him to a plastic surgeon at St. Joseph Hospital in Chicago named Dr. McKay McKinnon, who after 3 risky operations on Mester's face, was able to remove the tumor completely and to successfully reconstruct the man's face. Jose Mester's condition was caused by hemangioma, a venous malformation that begins to enlarge at puberty. Luckily for Mr. Mester, after a very difficult life, he was able to overcome the daunting condition. Rudy Santos. Rudy Santos, also nicknamed the Octoman, was born in 1953 in the Philippines. This man is the oldest individual to have a condition known as the parasitic twin. You may not believe it, but this is the actual description of Mr. Santos' condition. Firstly, attached to Rudy Santos' pelvis are his parasitic twin's legs, 2 arms, shoulders, and a pair of nipples, all of which are fully developed. Secondly, at Mr. Santos' abdomen, there is an underdeveloped head which has an emerging ear and a small area of hair. Thirdly, Rudy Santos' right limb is completely deformed, rendering him incapable of walking without using crutches. It is said that the twin got absorbed into Mr. Santos' body during the pregnancy period. Here is another fact you might find hard to believe. Santos attracted the nickname Octoman from his appearance as an attraction in freak shows between 1970 and 1980 where he earned money from his deformity. When doctors expressed an interest to perform an operation to rid him of the parasitic twin, Mr. Santos refused for the mere reason that he had grown to like the extra growth from his body. Minh An. This next individual is a little boy from Ho Chi Minh City in Vietnam that suffers from a rare condition known as ichthyosis. This is a genetic skin condition that produces a lot of dry, scaly, and dead skin on the whole body of the boy. Sadly, the little boy grew up facing a lot of stigma from his peers as he lived in an orphanage where he had no parents to turn to for support when things got tough. The boy's condition is believed to be as a result of the defoliate chemical called Agent Orange that was used by the Americans during the Vietnamese War. This condition is actually painful for the little boy as it causes excess heating of the body if he does not take regular baths. Minh An has been lucky enough to create a friendship with Brenda, a UK native who visits the boy every year in Vietnam. This friendship has greatly helped Minh in various ways at the orphanage, and he's now able to pursue his hobby in swimming every week as Brenda found him another friend to guide him. Didi Kaswara. This is an individual from Indonesia who suffered from a very rare fungal infection called epidermodysplasia verruciformis. This condition led to the creation of huge bark-like fungal growths on his skin, a condition that earned him the nickname Tree Man, which is ironical since Didi Koswara was actually a carpenter in occupation. His condition began when he was only 10 years old, when he began developing bark-like warts on his limbs and face. The attempt to remove the warts was not successful as they ended up growing back, and since he couldn't afford to pay for any medical procedures, warts exceeded and hindered his mobility and the ability to work, leaving him to depend on his relatives. Later in the year 2008, after his story had spread through the internet, he was able to undergo surgery that saw over 6 kilograms extracted from his body, which gave him the capacity to use his limbs again. However, his condition was incurable as the warts kept growing back and he needed surgery twice a year to control the growth. At the age of 42, Didi Koswara succumbed to health problems that were caused by his condition. Petero Byakatonda. Our list takes us to a little boy born in a little village in a rural town in Uganda. Petero Byakatonda suffers from a rare condition known as Crouzon syndrome, a condition that is only experienced once in 25,000 births. The condition leads to the disfigurement of the skull, which causes the eye sockets to be pushed outwards of their sockets, while the ears are pushed downwards. This can, in turn, lead to the inability to hear or see clearly. This kind of deformity is curable, but the lack of medical facilities in Petero's village had him living with the disease, facing regular torments from neighbors and relatives due to his weird appearance. However, a well-wisher doctor who noticed his condition offered to help Petero and raise sufficient funds to see the little boy undergo surgery in Austin, Texas. After risky operations and procedures for skull shaping and facial reconstructions, Petero survived the ordeal and is able to live a normal life like every other person in his village in Uganda. Didier Montalvo, Turtle Boy. As a small boy in the rural parts of Colombia, Didier Montalvo developed a rare condition known as congenital melanocytic nevus, which results in the rapid growth of moles on the whole body. This condition affected the little boy by causing an enormous mole to grow on his back, covering it in its entirety. This earned him the nickname Turtle Boy, as the mole looked like a turtle shell on the boy's back. Despite suffering so much stigma from other children and villagers, the boy was also removed from the local school for his condition. On the other hand, the resulting negative effects on the boy's confidence and the pain he experienced greatly affected him. The congenital melanocytic nevus condition is experienced once in every 20,000 newborn children. However, Didier Montalvo's growth was described as an extremity. Didier was lucky when his story was shared through a local newspaper, as donations amounted to figures that could pay for his operation. Neil Bustrode, a British surgeon, carried out the operation that saved Didier from his condition, thus giving him a happier, fulfilling life, as he was able to go back to school. Manar Maged, the two-headed girl. This is another case of a parasitic twin. Manar Maged was born in Cairo in 2004 with her sister conjoined at her head, a condition referred to as craniopagus parasiticus, whereby a parasitic twin's head with an undeveloped body is attached to a fully developed and functional twin. This type of deformation is said to occur in 3 out of every 5 million births. With no other body part, Manar's sister could only smile, cry, and blink. When she was 10 months old, the little girl became very sick and was taken to the hospital, where the doctors declared that failure to separate the two would lead to the death of both of them. Upon separation, the undeveloped parasitic twin passed away, as she depended fully on Manar's blood supply to her system. Unfortunately, Manar Maged only lived for less than 1 year when she succumbed to complications brought about by the previous surgery. Mandy Sellers. Our list takes us to Lancashire in the United Kingdom, where we meet Mandy Sellers, a lady who suffers from an extremely rare condition known as the Proteus syndrome. This condition is so rare that it is believed to only affect not more than 120 people in the whole world. The resulting effects of this condition on Mandy is an enlarged leg. Believe it or not, Mandy's leg is said to weigh about 95 kilograms, which is equivalent to a full-grown man. Not only that, but the leg is also believed to have a perimeter of 1 meter. This is the strange part though. Mandy has to wear special shoes that cost her a whopping $4,000 and has to drive a special car customized for driving without the use of her feet. Unfortunately, one of her legs had to be amputated, due to a vein thrombosis. It is such a big challenge living with a deformity of any kind. On the other hand, it is also a big responsibility for those who can provide care to an individual living with the deformity. Parents should be quick to act when they notice something unusual in their child and seek medical assistance immediately. As scientists continue to research certain deformities, we can only hope that those living with deformity are able to live a comfortable life. Thanks for watching.